Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Hafizah Muhammad Rosdi 139180. I am taking these classes Medical and Veterinary Protozoology BET403. Today I will talk about topic 1, which is the raptor, the sea raptor. So let's see. Okay, this is the question I get. So, let's see figure 1. Figure 1 was described as Trichomonas gallinae infection in raptor. It was concluded as Trichomonas gallinae infection because of why? Let's see. It is because the raptor appeared ruffled and emaciated with signs of labor breathing. In addition, postmortem also revealed large layerish Causal lesion in the upper digestive and respiratory tract and mainly located on the oropharynx, tongue, nasal cavity, hard palate, trachea, and larynx. All the symptoms mentioned was the clinical signs of this protozoa parasite, the Trichomonas gallinae. From the research I made, Trichomonas gallinae has a direct life cycle having no cyst or resistant form and can be transmitted from parents to nestling by crop milk, infected feeders or acquired in contaminated water. By the author, Cochran 1969, DeCarli et al. 1979, Cole 1999, Purple Angel Hort 2015. Trichomonas gallinae, the etiology agent of avian trichomoniasis, which is a mitochondrial anaerobic protozoan and a flagellated parasite in the class Zoomastigophoria and order Trichomonadida. The protozoa are the worldwide parasitic disease that found in the superior digestive system of clinically and subclinically infected birds. In clinically infected birds causes pathologic changes such as inflammation of the mucosa and causal lesion which can block the esophagus and subsequently causing death of the host through starvation. By the author Nassisi et al. 1991. Then, from this article, we can find that trichomoniasis is a serious protozoan disease mainly caused by Trichomonas gallinae, which infect the upper digestive tract of the bird. This parasite infect a wide range of birds such as pigeons, chicken, turkey, and other poultry worldwide. Infection by Trichomonas gallinae may be asymptomatic or may lead to death with intermediate symptoms including anorexia, vomiting, ruffle feather, diarrhea, dysphagia, dyspnea, weight loss, and increased. Some reports also indicate that multiple large avian mortality events have been associated with trichomoniasis. Unfortunately, the raptor must be infected by eating the prey that have the Trichomonas gallinae infection. It is also because this disease can only be affected by direct contact, which is by feeding on other infected birds. Okay, so we will discuss about Trichomonas gallinae infection by going through 3 questions that was asked. The first question is, what is your most likely diagnosis? The diagnosis of oral trichomoniasis by Trichomonas gallinae was based in clinical sign, microscopy, and histological lesion, and also morphological identification of the agent. It was described by other authors, Stabler 1941 and Abraham and Hornibrook 1964. The most reliable diagnosis is by demonstrating the presence of Trichomonas, a prey-shaped parasite with flagella, by using microscopic examination. The wet smear should be prepared using cotton teeth swab soaked in warm sterile psychological saline solution. The content also must be immediately examined under the microscope using medium or large magnification in order to observe the typical morphology. When the intensity of the infection is low, the small number of parasites might go undetected. So, in these cases, an initial enrichment by cultivation is very helpful. For more sensitive diagnosis, various PCR assays have been developed, but their use as routine examination might be costly. Besides, staining method also can be used to diagnose the Trichomonas gallinae, namely Giemsa stain and gram stain. Smears like containing Trichomonas gallinae were dried in room temperature for 15 to 20 minutes and stained using gram stain. Smears like containing Trichomonas gallinae were fixed and dried with methanol for 30 seconds and stained with Giemsa stain and allow it to air dry at room temperature by the author Tasker and D. Caldi 2003. The dry slide was rinsed with distilled water and allowed to dry at room temperature. Then the slide was observed under 40 times and 100 times magnification. The last one, Trichomonas can be cultured easily in various artificial media such as Diamond's media, 0.2% Lofer dried blood serum in reduced solution, or a 2% solution of pigeon serum in isotonic salt solution. The positive sample was cultivated in 4 different media, namely modified media TYM, which stands for Triptychus yeast extract media, and CLPM media, which is cysteine peptide maltose media. Okay, now we will move on to question number 2. Question number 2 is, how can you stop the spread of infection in the raptor center? The infection of Trichomonas gallinae can be prevented from spreading to others uninfected birds by isolation. Put the infected raptor into quarantine and captive them alone. Besides, food and water sources should be cleaned regularly and protected from contamination by wild pigeons and other birds. In addition to that, routine good hygiene on bird feeders. Provision of clean and fresh drinking water on a daily basis is also important. Do not forget to make sure provision of fresh food from accredited sources too. Next is rotate position of feeders in the garden to avoid build-up of contamination in any one area, and do not allow accumulation of seeds to occur, for example on the ground below feeders, and also particularly on surfaces that are damp or contaminated with feces. Okay, so for the last question, which is question number 3, how can you treat sick raptors? Drugs are available for the treatment of trichomoniasis and it must be done orally. Several drugs that are available to treat the trichomoniasis are the first one, metronidazole with 60 mg per kilogram body weight, and the second one is dimetridazole with dose 50 mg per kilogram body weight, and the last one is ronidazole with dose 30 mg per 1 individual. As resistance to this drug was reported in various strains of Trichomonas gallinae, commercial products containing combination of these have been developed, such as the combination of metronidazole with ronidazole. All these products are soluble and are given in drinking water for 5 to 6 consecutive days. The recommended concentration is 0.05%. That's all from me. Thank you.